Welcome to this deep dive. We're diving deep into cardiac revascularization, and you've sent us some really interesting research on this. It's all about how we go about restoring blood flow when there's a blockage in the heart.
Yeah, it's fascinating, this whole area. What's captivating is that it's not a one-size-fits-all. There are so many different approaches, and each one has its own advantages and, of course, potential downsides too, things you have to really consider.
Right away, I'm seeing PCI, percutaneous coronary intervention, right?
Right.
And this seems like it's often the go-to in emergency situations, and it's less invasive than, say, open heart surgery, which sounds pretty major.
Oh, absolutely. PCI, sometimes it's called coronary angioplasty, and basically what we're doing is threading a catheter to where that blockage is and using a tiny little balloon to open it up. The beauty of PCI is its speed, so when that heart muscle isn't getting the oxygen it needs, every second is crucial. And there are guidelines, from the American Heart Association and American College of Cardiology Foundation. 90 minutes to get that artery open from the moment that patient arrives at the hospital.
Wow, 90 minutes. That really puts it in perspective how critical a quick response is.
Mm.
But it's not always the right approach, right? There are times when PCI isn't suitable.
Yeah, you're right. So if you have blockages that are kind of in those hard-to-reach places within the heart, PCI might not be suitable. Also, if there are multiple blockages, that's where some of these other options come into play.
Okay, that makes sense. Now, one that I saw in here that caught my eye is thrombolytic therapy.
Okay.
It sounds pretty sci-fi, to be honest.
It does sound a little futuristic, doesn't it?
Yeah.
So imagine this. You've got this clot, and it's basically stopping that blood flow to the heart. Thrombolytic therapy is like sending in this microscopic team to break down that blockage, and it's really effective, particularly for a specific type of heart attack. Have you heard of a STEMI?
A STEMI?
STEMI, it stands for ST elevation myocardial infarction.
Okay, so break that down for us. What does that actually mean for someone who might be experiencing that?
So a STEMI is a very serious type of heart attack. It's where one of those major arteries is completely blocked, so a significant portion of that heart muscle is being starved of that oxygenated blood.
So this thrombolytic therapy is like sending in, I don't know,
The cavalry.
the cavalry. That's a great way to put it. But are there any drawbacks? What about risks associated with it?
There's a critical element here, and that is time. So there's a very limited window of opportunity. We're talking a couple of hours max from the onset of symptoms to administer these medications effectively. Speed is of the essence, and of course, like any medical procedure, there are inherent risks, and bleeding is probably the most significant one that we watch out for.
So it's really a race against time, and the stakes couldn't be higher.
Absolutely.
And that's why it's so important, even just knowing these terms, that if somebody's experiencing something, they can articulate that and get help immediately, right?
Absolutely. Recognizing those signs of a heart attack, and as you said, even just knowing the terms and calling for help right away, that can be life-saving.
Now, you also sent some information about coronary artery bypass grafting.
Right.
So what exactly is
So
that?
sometimes you just need a more extensive approach to really restore that proper blood flow to the heart, and that's where coronary artery bypass grafting, or CABG as it's often called, comes in. Think of it like this. You've got a blocked highway. We're going to create a detour.
Okay, so we're rerouting. We're creating a new route for that blood to flow. So how does that actually work surgically? What are they doing?
So surgeons will take a healthy blood vessel, and this is what we call the graft. It's typically taken from another part of the body, could be the leg, could be the chest, and they use that to bypass that blocked section of the coronary artery. They're basically connecting this graft above and below that blockage, allowing the blood to, freely flow around it. It's major surgery to be sure, but it can be life-saving, especially for those complex cases.
So this seems like it's a more involved procedure than, say, the PCI or that thrombolytic therapy. What are the advantages of going with this approach?
You're right, it is more involved. It's often considered the gold standard, though, for treating complex coronary artery disease. So particularly those blockages that are really difficult to reach with PCI, or if a patient has multiple blockages, CABG is often the way to go.
Now, this is where it gets interesting. You have something in here called a mid-cab.
Yes.
So is that like a smaller scale CAB?
You got it. MIDCAB stands for minimally invasive direct coronary artery bypass. It's essentially a less invasive version of that traditional CABG.
That already sounds like a major plus.
It is.
So what's different? What are they doing differently?
So instead of that large incision in the chest, surgeons will make a smaller incision, usually on the left side of the chest. And here's the remarkable part. They're actually performing the bypass without stopping the heart.
Wow, bypassing a blockage without stopping the heart? That sounds like a huge advantage.
Oh, it can be a game changer. And it doesn't even stop there. You also have off-pump CAG, where they slow the heart down but don't stop it completely. And then there's TICAB, where they use tiny cameras and instruments to perform the bypass through very small incisions. So, the choice of which procedure really depends on a lot of factors.
Yeah.
The patient's overall health, where are those blockages, how severe are they, and of course the surgeon's experience comes into play as well.
So it's not just as simple as you need this procedure. There's a whole thought process that goes into deciding what the best approach is.
Absolutely. It's truly a collaborative effort. You've got the cardiologists, the surgeons, and of course, most importantly, the patient working together to weigh those risks and benefits and come up with the best plan.
And then, of course, after all is said and done, postoperative care is so important, right? No matter which one of these procedures a patient undergoes.
Absolutely. Postoperative care is paramount. It's all about managing that pain effectively, preventing complications, and helping the patient recover as quickly and safely as possible.
Now, you mentioned in here something called sternal precautions
Mhm.
after CABG.
Right.
What does that involve?
So because CABG does involve making an incision through the breastbone, that's the sternum, patients have to be incredibly careful for several weeks after surgery to avoid putting any stress or strain on that incision while it heals.
So no lifting heavy boxes or like strenuous activity for a while.
Exactly. They'll need to avoid certain movements, lifting heavy objects, reaching overhead. Even getting out of bed or moving around requires a special technique to avoid putting pressure on that chest. It's almost like having to relearn how to move.
To protect your heart, literally.
Literally.
And that's something people don't often think about, those physical limitations that are often part of the recovery process. It's not just the surgery, it's that whole journey back to health. What about complications? We've talked about the procedures themselves, but after any one of these, what are some things that the medical team really needs to be on the lookout for?
Well, you've hit on a really critical aspect of cardiac care because, recovery is an ongoing process. And with any surgery, there are always potential complications.
Right.
Cardiac procedures, no exception. Some of the things we watch out for very closely, things like infection, bleeding, arrhythmias, that's irregular heartbeats, and then something called graft occlusion, which is when that bypass graft actually becomes blocked.
And catching those things quickly and managing them effectively is so important for a successful recovery.
Absolutely. Early detection and prompt treatment are key to preventing those from becoming even more serious issues.
This has been really insightful. So we've covered a lot of territory here, from understanding what these different procedures are to how important that postoperative care is.
We have, and honestly, we've only just scratched the surface. This field of cardiac care is so complex and constantly evolving. But, I do believe you now have a much clearer understanding of the key players in this really high stakes game.
I agree. You've given us a lot to think about, that's for sure. But before we move on, I want to pause for a second and bring it back to our listener.
Yeah.
What does all of this mean for them?
I think that's such an important point to raise. It's one thing to grasp the medical terminology, but it's another thing to really understand what it means for your health, for your well-being.
Yeah. And so much of it is knowledge is power. Understanding these different approaches, knowing what the risks and benefits are, that empowers you to be a much stronger advocate for your own health.
I couldn't agree more. And knowing those signs and symptoms of a heart attack and seeking immediate medical attention if you even think something is going on, that can be life-saving.
Absolutely. Don't wait. If you're experiencing symptoms, call. Don't hesitate. That early intervention is key. Now, we've covered a lot of ground in this first part of our deep dive into cardiac revascularization. But before we get into some of the other aspects of this, we're going to take a quick break to process all of this great information. When we come back, we're going to be exploring the psychological side of these procedures. What does it mean for the patients and their families? So stay with us. Welcome back to our deep dive into cardiac revascularization. Before the break, we were talking about these different procedures, how complex they are, but also how crucial that postoperative care is. But now I kind of want to shift gears a little bit and talk about something you mentioned earlier, that psychological impact of all of this.
It's so important, and it's something that often gets overlooked, I think, because we tend to focus so much on the technical aspects.
Yeah.
But that emotional toll that heart problems can take, not just on the patient, but on their families, it's huge.
Oh, absolutely, because we're talking about this is major stuff. Having a stent placed in your heart or undergoing open heart surgery like we've been talking about, CABG, I mean, these are life-altering events.
Exactly. And because they are such significant life events, it's completely normal for patients to experience this whole range of emotions, anxiety, fear, even a sense of vulnerability.
Of course, it's a lot to process, both physically as you're recovering, but emotionally as well. It's not just about the physical healing, it's the emotional healing that needs to take place as well.
And that's why it is so crucial, both for the patients and for their loved ones, to have those strong support systems in place. That could be anything from professional counseling to support groups, even just open and honest conversations with their healthcare providers.
Having those open lines of communication with your healthcare team, talking about everything that you're going through, and knowing that you're not alone on this journey, I have to imagine that makes a huge difference.
It really does. And remember, you are an active participant in your healthcare journey. The more informed you are, the more engaged you are, the better equipped you'll be to navigate all of the challenges and, of course, celebrate those triumphs that come along the way.
And speaking of triumphs, I want to shift our focus now to life after cardiac revascularization.
Yeah.
So what does recovery actually look like, and what are some things that patients can do to really optimize their heart health over the long term?
Well, the recovery time, it does vary quite a bit depending on the procedure. So if we're talking about PCI, patients can often go home the same day or the next and get back to their normal activities fairly quickly. But with CABG, because it is a more invasive procedure, that recovery period is longer. We're talking several weeks, maybe even months of gradually increasing your activity levels.
So it's a marathon, not a sprint, especially for those CABG patients.
That's a great way to put it. But regardless of the procedure, there are some key things that can really contribute to a smoother recovery and better long-term heart health.
Okay, so what are some of those must-dos for life after cardiac revascularization?
Well, lifestyle modifications are huge. We're talking about adopting a heart-healthy diet,
Hmm.
low in saturated and trans fats, cholesterol, sodium. Regular physical activity is also key. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And then, of course, the big one when it comes to heart health, quitting smoking.
Okay, so those are all things that, we hear a lot about. But are there some less obvious things, things that maybe patients wouldn't necessarily think of that can make a big difference?
Absolutely. One area that often gets overlooked is medication adherence. You see, a lot of patients are prescribed medications after cardiac revascularization. It could be to manage blood pressure, cholesterol levels, or to prevent blood clots. And it's crucial to take these medications exactly as prescribed by your doctor, even if you start feeling better.
Yeah, because it's easy to fall into that trap of, oh, I'm feeling good. Maybe I don't need this anymore.
Right, but that can be risky because these medications are often essential for preventing future cardiac events. So don't skip doses, don't discontinue them without talking to your doctor.
So those regular checkups with your healthcare team, those are a must.
Absolutely. For
Yeah.
monitoring your recovery, for making those medication adjustments as needed, for addressing any concerns, it's all about being proactive.
Yeah, being proactive, taking ownership of your health, and keeping those lines of communication open.
100%. It's about being an active participant in your own well-being.
I love that.
Yeah.
This has been so informative. We've covered the procedures. We've talked about that recovery process, those lifestyle changes that are so important.
And that open communication, that self-advocacy, all key.
Yes. Now, before we move on to the final part of our deep dive, where we're going to be looking ahead at what the future holds for cardiac care, I want to circle back to something you mentioned before the break, and that was the psychological aspect of all of this. We touched on the emotional toll that a heart condition or procedure can take, but I'd love for you to elaborate a bit more on how individuals can really manage those emotions effectively.
It is such an important aspect of cardiac care, and it's something that we as healthcare providers need to address more openly and more frequently. This is a significant life event. You're potentially facing your own mortality, and that can unearth this whole wave of really complex emotions. Fear, anxiety, uncertainty, these are all normal reactions. Don't bottle those feelings up. Address them head on.
So what are some steps that people can take to do that, to manage those emotions? What advice would you give to someone who might be struggling with that psychological impact?
First and foremost, don't be afraid to seek professional help. Talking to a therapist, a counselor, someone who specializes in cardiac care can be incredibly beneficial. They can provide you with tools and strategies to really cope with that emotional roller coaster that often accompanies this journey.
Therapy can be so valuable.
Yeah.
And then what about the power of connecting with others who understand what you're going through?
Oh, it can be incredibly powerful. Joining a support group, whether it's online or in person, it provides that sense of community, that shared understanding. It's a safe and supportive space to share your experiences, your fears, your triumphs with people who truly get it.
Knowing you're not alone, that's so important. Reaching out, connecting, realizing that you're not alone on this journey.
Exactly. And always remember, there's hope. Advances in cardiac care are happening all the time. With the right treatment, a solid support system, those lifestyle changes we talked about, you can absolutely live a long and fulfilling life.
That's an inspiring message to carry forward. Now, before we dive into the future of cardiac care, let's take a short break to absorb everything we've covered so far. We'll be right back with the final part of our deep dive into cardiac revascularization. Don't go anywhere. And we're back, ready to explore the future of cardiac revascularization. We've covered so much ground already, it's mind-boggling. But I always love a good glimpse into what's next.
Oh, absolutely. Especially in a field like cardiology, always something new and exciting just around the corner.
So what are we looking at here? What are those game changers, those innovations that have the power to really revolutionize how we treat heart disease in the years to come?
Well, one area that's causing quite a stir in the cardiology world is the development of bioabsorbable stents.
Bioabsorbable, like they just disappeared. I feel like I'm living in the future already.
You got it. So traditional stents, they're made of metal and they stay in the artery forever. But these bioabsorbable stents, they're made of materials that, get this, naturally dissolve over time. We're talking a couple of years and poof, gone.
That is wild. Okay, so the artery heals, the stent's done its job, and it just fades away. What's the benefit there compared to the ones that are permanent?
It's all about reducing the risk of long-term complications. See, as effective as those metal stents are, sometimes they can cause issues down the line, things like inflammation or blood clots. There's even a risk that the artery could narrow again. That's called restenosis. But with these bioabsorbable stents, once they've served their purpose, they're out of the picture, which means potentially fewer complications.
So it's kind of like a support beam that gets taken away once the building is strong enough to hold itself up.
Perfect analogy. And, bioabsorbable stents, they're really just one piece of the puzzle. Researchers are looking into some incredible things like gene therapy to repair damaged heart muscle and stem cell therapy. Imagine being able to regenerate healthy heart tissue. And then there's artificial intelligence.
Okay, now you're just messing with me.
Yeah.
AI for heart health.
I know, right? It sounds like something straight out of Star Trek. But AI is making huge strides in medicine already. In cardiology, we could be talking about algorithms that can analyze medical images, those echocardiograms, CT scans, things like that, with amazing speed and accuracy. They could even pick up on things that the human eye might miss.
So AI could be like the superpowered sidekick for cardiologists, helping them make faster, more informed decisions.
Exactly. And it goes even further than diagnosis. Imagine personalized treatment plans based on your unique genetic makeup, your lifestyle, all those things. That's the potential of AI in cardiac care.
Wow, this is incredible. It feels like we're on the cusp of something truly revolutionary in how we approach heart health.
We are. And what's really exciting is that these advances could not only make treatment more effective, but even prevent heart disease altogether in some cases.
Now, that's a future I can get behind. So as we wrap up this incredible deep dive, what's the one thing you really hope our listeners take away from all of this?
I think it really boils down to this. Never underestimate the power of knowledge. Understanding your own health, asking questions, being proactive, and staying informed about these advancements, those things are incredibly empowering.
Knowledge is power. I love it. And you have definitely given our listeners a lot to think about today. We've gone from those established procedures to the absolute cutting edge of cardiac care.
It's been my pleasure.
The pleasure was all ours. But remember, this deep dive, it's just the beginning. Keep asking those questions, stay curious, and who knows, maybe you'll be the one pioneering the next big breakthrough. Until next time, thanks for joining us on this amazing deep dive into the world of cardiac revascularization.